Good morning, everyone. I think we may actually be into afternoon now. Thank you so much for joining us. I'm Jessica Blackman. I'm Director of Health Research Operations at Vector Institute, and I'm pleased to welcome you to our panel, Transforming Health with AI That Can Be Trusted, Driving Research Adoption and Impact Through Innovation. As artificial intelligence reshapes healthcare delivery, building trustworthy AI and scaling solutions has become paramount. Today, we bring together leaders from innovative startups and established healthcare organizations across the health innovation ecosystem to explore how Canada's commitment to AI excellence is creating new opportunities for healthcare transformation. I'm honored to introduce you to our very distinguished panelists. Dr. Dante Morra joins us as the founder and chair of Can Health Network. A transformational healthcare leader and specialist in internal medicine, Dr. Morra has dedicated his career to advancing Canadian healthcare through innovation and commercial partnerships. His work has earned him recognition among the Globe and Mail's top 50 executives for translating ideas into real-world change. Fanny C. brings over 2 decades of experience as a clinician, researcher, and business development professional. At Roche Global, she is in the role of Head of AI and Emerging Technology External Collaborations, M&A Partnering, Roche Global Informatics, and founded the One Roche AI Center for Excellence. Her background spans from hands-on clinical work as a radiation therapist to scaling digital health solutions nationally. Dr. Devin Singh is a staff physician and clinical AI lead in pediatric emergency medicine at Toronto's Hospital for Sick Children, as well as CEO of Hero AI. His research focuses on applying machine learning to address healthcare's greatest challenges. This work has earned him a TCARM Telemetry Innovation Grant. And Mahshid Yassaei is co-founder and CEO of Tali AI, Canada's leading AI assistant for clinicians. Prior to Tali, she co-founded Evenset, focusing on healthcare software development. With a master's in computer science from McGill, she brings a deep technical expertise to healthcare innovation. Together, we will explore how to build trust in AI healthcare, scale successful solutions, and ensure responsible innovation that benefits all Canadians. Thank you so much. Thank you all so much for being here today. Our first question actually touches on something that Dr. Gilbert mentioned during her fireside chat this morning, and that's how we bake in ethics to AI from the development stage all the way through. Many organizations, Vector included, have developed AI trust and safety principles that reflect how we feel the development and deployment of AI should be approached. So some examples of these are AI solutions that reflect democratic values that benefit humans and the planet, and AI solutions that are robust, secure, and safe. How can we ensure that these principles are embedded into practice right from the development stage? Fanny, do you want to kick us off?
Sure. So I think it's an excellent question because we're always thinking about the long term at Roche. So at Roche, we build drugs as well as diagnostic solutions for the globe. And we know that artificial intelligence is very much an enabling tool in order to bring the best to our patients, to be able to enhance decision-making by our clinicians, as well as to inform the system. We have developed the Roche AI ethics principles that were published in 2024, along with collaborators such as Vector, and influenced by best practices from universal or global organizations such as WHO, UN, as well as global standard agencies such as NIST and ISO. So our AI principles are rooted in accountability, transparency, enabling human accountability, being able to ensure privacy and security and sustainability. We are actively building protocols so that people can build their solutions from end to end. But we know that we can't account for every single tactic and be beside every single developer or user. So anchoring in principles when no one is watching will help people build a culture where we can be sure that the solutions developed are trusted. Another thing that we're doing as well is that we're not only focusing on solution development internally, but we are also focusing on who we partner with. So all of these principles are questions that we end up asking any potential collaborators or any potential target companies that we plan to acquire. And what we want to do is make it very transparent and clear on our requirements for a valued partnership. So you'll see in Q2, we will be publishing a paper that will show what types of considerations we take into account when we look at our partnerships.
Thank you so much. Dante, I was wondering about your perspective on baking in ethics from the development stage.
All right, so I'll come at this from a couple different ways. I promise to be punchy, actually, because we're sort of 4 panels in. But number one, you have to build it into your ethics framework. So your REB has to be set up if you're doing research and design, and you actually have to build out expertise there so they actually know what they're talking about as it comes through. The second is on your compliance side, you always have to have a compliance part of your organization that's actually monitoring and bringing solutions in, and it's stacked in a way that it really understands how it's going to make those decisions and have a lens of how it's actually evaluating technology coming in. But the third thing is actually, I think, even more important. So it's what you're accelerating. So particularly at Trillium, what we do is we measure our clinical outcomes based on racial and social economics. So I can tell you our urologists operate on white men who are from postal codes that have high socioeconomic status. If you accelerate your AI into that use case, what you can do is just drive out further bias and further actual issues of disparity. So you actually have to not only govern it from an ethics point of view, have structures in place to be able to adopt the technology, but where you aim it, particularly in healthcare, is incredibly important.
Very interesting. Devin, from a Sick Kids perspective.
Yeah, happy. I mean, amazing answers thus far, and I totally agree, Dante, with what you'd mentioned. I sort of see the landscape from 3 perspectives. One, from like a regulatory perspective and a legal perspective. You know, Health Canada is coming out with a variety of regulatory frameworks and guidelines. You'll see Bill 194 coming out in Ontario that will also have some influence on this space. And so there's mechanisms where the regulators or the lawmakers may start to sort of enforce a bit around what is a standard in which an AI solution needs to be held to. You can think of it from a hospital perspective as well, and many of the things that Dante has mentioned around how can we think about, and this with my Sick Kids hat on, going from a problem in a clinical space or in an operational space to getting a solution actually deployed to the bedside or into an operational workflow in a very like streamlined way, but isn't just ignoring some of the key critical pieces that Dante had mentioned, right? And so one of the things that we're working on at Sick Kids really diligently over the last few years, and there'll be some big announcements at the end of the month on this, is innovation through process and governance, right? Having a streamlined process where the privacy, the legal, the REB, the QI, all of the key enablers to getting a project actually to the bedside are there in one space, right? Not having as an innovator to go to 6 different committees to sell the same song and dance to go through this like sort of redundant process. Is there a way that we can innovate our processes as an organization to streamline? And from real quick, an innovator perspective in industry, you know, just because a hospital doesn't necessarily ask Hero AI, we want to deploy this solution, and here's what we want for monitoring, and they don't really want to look at like bias or sort of the ethics of and the equity of a solution. From a company perspective, we're going to do that anyways, right? And we're going to say to the hospital, you don't have to pay more for this. Like, this is the transparency that we think that industry and innovation should lean in with to enable this like ethical, safe, responsible adoption of AI solutions into the market.
Very interesting. And from a startup perspective, I'm just wondering if there's a different approach you take because there are less inherent processes in place to begin with, or if it's similar across the spectrum.
Yeah, so for those in the audience that don't know about the space we are in, it is the first time in history that we are hearing the narrative of the patient in their own words. And you can imagine what potential it unlocks, but also at the same time, that sensitivity of the information that's been gathered. And for many reasons, the space we are in is probably the first or the fastest growing piece of technology in healthcare. So then, as you said, as a startup, we are facing this question of how do we move fast, and how do we protect the security and privacy information and also remain ethical. So there are two approaches we have, top to bottom and then automation. So from the top to bottom piece, in our company-wide vision and mission statements, we clearly say we believe in a human healthcare. So we are not replacing clinicians, we are empowering clinicians, making sure that everybody in the company, from every individual engineers to the sales reps, to the customer success, they know we are here to support clinicians that will at the end support patients. Or on the other hand is like, I make it very clear to everybody in the company, like if there is a smallest incident on security and privacy, we are done. Like the company is over, we're not negotiating on that. So I make it very, very clear from the top that this is super important for everybody to have top of mind. But then there are things we do inside the organization that will help us hold accountable to things that we now believe. For example, the SOC 2 Type 2 process that we committed to very early on, there was one reason behind it, because they basically what they do is that this is a third-party organization that comes in and checks your architecture review, like on the technical side, but also all of your processes as an organization. And they do it regularly to make sure that you maintain your certification. By having something like this as an organization, as a commitment to keeping our SOC 2 Type 2 certification, we are protecting ourselves from making mistakes against our own beliefs. So because yes, we do believe that we should do these things, but as a company that's just moving so fast, we need ways that will hold us true to what we believe on. Or the other thing is, in terms of the validation set, so similar to the days of software where we had this integration test that every time we wanted to deploy something, this integration test would run to make sure nothing is being broken. The validation set that we have developed and will continue to develop, we make sure that it has diverse data sets, people with accents, clinicians with accents. This is a reality of the Canadian market where we have 2 languages and hundreds of accents. So are we supporting everybody equally? These are the things, as I said, and if you only do things that you measure. So we want to make sure that that validation set automatically is protecting us from making mistakes that will make our solution unfair to a population.
Thank you so much. So I think there's consensus that there's just a huge impact potential for AI in healthcare. I think there's probably also consensus in the room that there's a lot of risk that goes along with that. My next question has to do with implementation, and as healthcare organizations integrate AI solutions, building trust is paramount. What specific approaches have proven most effective in establishing trustworthy AI systems, specifically regarding data privacy, algorithmic bias, which we've already touched on a little bit, and clinical validation as well? Would anyone like to take that one? For Devin, would you like to start us off?
I mean, we could do a 2-hour lecture.
I know. These are just
synthesized to 90-second response. Okay. Well, when I'm thinking, just let's put ourselves at the bedside, right? I'm an emergency doctor. Patient volumes are rising. Wait times are increasing. As wait times increase, you actually start to lose trust from your patients in the system and in the system's ability to deliver care that they need. And you feel it on the front lines. And unfortunately, sometimes you see adverse patient outcomes occur, and it's tragic. And so there is this pressing urgency to get technology to figure out how do we take AI and really add capacity back to healthcare. But at the same time, we have to figure out how do we do this efficiently, effectively, and expeditiously while still maintaining trust, privacy, rigor, these tenets of evidence-based medicine and ethics. And so one of the ways that we're approaching this at SickKids and at Hero AI, sort of working together, is when we start to craft new workflows that we deploy into the emergency department that have aspects of AI-enabled automation built into it. For example, automating a psychiatry consult right after triage, or automating identifying that a patient has an acute surgical condition is accidentally waiting too long, right? Those workflows, as a company, we don't come into a hospital and say, hey, this is the workflow, this is how it is, just deploy. We actually bring in a platform and we co-build the workflows. Like the innovation piece around how we've built trust with the clinicians is not to say this is how you're gonna do it and just trust me. It's to say that here is a platform for you to then build your own types of AI automations onto. And you instantly, from the beginning of an engagement, a clinician is now starting to guide the way the AI is going to behave. And you start to generate trust from that process. But then you start to bake in the key parameters for validation, for monitoring, post-deployment, and you keep this like authenticity from a company perspective and this sort of responsibility to that hospital and to the clinician in the workflow to be transparent, right? Around, yes, we've deployed this tool, but actually here's where it's working well and here's where it's not working well. And these are then the things we need to do to improve safety in this area. It's that transparency along the continuum that I think builds authentic trust rather than, hey, just trust me, right?
Just a quick follow-up on that for anyone who wants to jump in. Is there ever difficulty in building that transparency when you're kind of working between two very different, very specific skill set, where you have your, I think some of the individuals on this panel are a bit of an exception, where they're very skilled in AI and technology and also very skilled clinicians, but often that's not the case. So how do you bridge that gap while still ensuring that you're building trust? And anyone can feel free to jump into that.
Okay, I'll answer that, but I'm going to come at this you need translators, right? Like in healthcare, you actually need these people who can bridge and translate and describe risk, finances, clinical outcomes, technology, and those people are essential in healthcare to make change happen. Just to build on the point, I think in healthcare, it's a lot about reframing. So you mentioned, an adverse event, or sometimes that's really bad. Like 7% of every patient who comes into the hospital and gets admitted gets an adverse event. Like we hurt people constantly in healthcare. We're failing on access, sustainability, and quality. So often what you actually have to do is reframe the situation to be able to describe what is actually happening, and that the test for the technology can't be so much higher than the current standard. The cybersecurity and privacy stuff, that's table stakes. You are connecting into billion-dollar organizations, which people are attacking all the time. You have to understand that. But it's really important to always be able to describe what is actually happening right now and what's that burning platform. And then what you have to do around trust is you actually, in a hospital or in healthcare, the problem with healthcare is everybody's a user. So everybody thinks they understand healthcare, so they build things for healthcare. But everyone's a user for energy, but they don't build things for nuclear plants because it's complicated. So in healthcare, there's a complexity issue around understanding who gains from the technology. So the physician may be billing more, but that may be costing the hospital more, which may then actually hurt the patient more. So the secret is finding the Venn of where you're actually getting benefit for the providers, the institution, and the patients. And that's actually really hard to do. Usually everybody's talking about one part of that Venn, not understanding what's in the middle of that quadrant. And that's actually, in building trust, is actually essential that people don't actually talk about. And then finally, I agree with the point of you actually have to create these cross-sectional teams depending upon the complexity of the problem. So if you're doing, Tali does great work on AI scribes, and you can adopt that into a technology in a simple way. It's not simple, but the use case is clearer. Whereas if you're in the center of a hospital looking at discharge or complexity, that's some of the work we did with Signal One, you need very, very stacked up teams that are protected to be able to deal with this complicated problem. So you have to work across those different areas and understand that as the complexity goes up, your transparency and the amount of effort you have to put into it also goes up.
Thank you. I hadn't actually ever considered the Venn diagram as an approach to AI in healthcare before. That's a very interesting analogy. Thank you. Fanny, did you want to?
Oh, it works. Okay. I'm trying to synthesize some of the conversation because I think no matter what industry we're in, we seem to have the same challenges. We're building our AI governance structure, and that very much is built with global leaders in quality, in regulatory, in legal. And now they're entering a space where they have to build protocols that they are unfamiliar with. They don't necessarily have the domain knowledge to understand all of the risks, so our governance structures have to be transparent. Also, we're embedding data scientists and engineers within these governance structures so that they can understand from the use cases that we intake where the risks lie. So, we talk to these governance structures and we're like, you need to have domain knowledge. And they're like, why? We're fine. And we say, well, do you know what model poisoning is? Do you know what model theft is? And they're like, okay, yeah, we do need these. So there is a lot of grassroots learning, and I really like the comment made this morning by Laura Gill about the practicalities about some of these subjects. We can talk about them up here, but when we operationalize things, we actually have to get tactical. So being able to associate, let's say, the principles that we're focusing on to these risks, and then to mitigation strategies, both at the technical level and business process level, is important. And then we share that from a lens of transparency. So something that I think is really cool that I've never seen before is that this organization is a global organization. There are 100,000 of us all over the world. They're going to provide us with education across the entire enterprise in a very condensed manner, as a focused effort to bring literacy to a baseline. And that not only includes base knowledge on data science, but also tutorials, so people have hands-on knowledge of what exactly is being affected, and so they can think within their context what the consequences are along the value chain. And I think that's really cool.
Thank you so much. I want to get into one more topic before we have to wrap up. We've talked a lot this morning through the panels and fireside chat about the regulatory environments, how important it is to build trustworthy AI. What I'm wondering is how we then balance the risks versus scaling success. So Canadian healthcare companies are facing a very rapid modernization through technology, where those at the forefront are winning big and many are risking being left behind. Canada's role in this and how we win in this is very important, especially in today's context. How can we approach balancing the risks of going too fast and breaking things versus being left behind? And is it, I guess it's a two-part question, is it a trade-off? Mahshid, do you want to start us off?
Absolutely. I'm the type of CEO that VCs don't like. I advocate for slow and thoughtful progress in healthcare. And I think the scale and being cautious of all the concerns you brought up, it doesn't have to be a compromise. The way we are approaching this is that, first of all, and to your previous point, as a company of all engineers, like I'm an engineer, my CTO, obviously my head of product, my CEO, everybody's engineer, and we're always so insecure about this. So we quickly started a panel of physicians to be alongside us. We're in constant conversation with physicians, and very early on, we tried to make partnership a very strong pillar of growth for the company. Meaning that, okay, there are organizations that have been playing in this space, like TELUS Health, QHR, etc. These guys know more than what they do. They have some level of trust and credibility, so how do we partner with them? But not just that, with government agencies. Like we know organizations like Ontario MD, ECE, they're doing a lot of great work here, really creating friendship and partnership with these organizations to be part of the conversation and really get a lot of insights from them as well. So I think we can win, Canada can win, and we can scale fast only if vendors and industry works very closely in a partnership / friendship, very close partnership with government, regulatory bodies, and everybody. I think that is honestly kind of a intrinsic nature of healthcare, I think, I don't think much can happen without partnerships, but specifically in a case like AI, which is risky, which is everybody has lots of questions about, it's important to stay close.
Absolutely. Would anyone else like to build on that?
Yeah, just like when I look at barriers to AI adoption to the bedside, and I put my Hero AI hat on, and lots of hospitals reaching out to us wanting the platform, which is really exciting. But then when you start to describe like what clinical automation really is, a hospital may not understand like, wait, how do we even say yes to this? Right? Like what are the actual parameters in which we need to evaluate to feel confident as a buyer of the solution to actually say yes confidently and to know that I'm doing so in the right way. And when I look at the ecosystem widely, I see a lot of really cool AI in flight, but we don't necessarily have the runway to land the planes, right? To land the AI to the bedside to drive impact. And so there is a role here that's really interesting for the regulator or the provincial bodies. And I challenge the innovators in the space to not necessarily see regulation as a barrier, a roadblock, but there is a role here to create that runway so that we can't just not only adopt like the simple AI solutions, but actually adopt some of the really complicated, much higher risk but higher reward solutions as well, because we have a proper regulatory runway to build confidence in the community to adopt these tools. But that runway cannot be like you got to pay 500 grand to get an assessment and you need to wait 6 months and a year. Like there needs to be innovation in the regulatory process itself to make it feasible. Right? If we can crack this, not only can we build more confidence in the buyers and in healthcare as a whole, we can create like an industry landscape where we can innovate quickly and get much more impactful, risky types of AI solutions landed to the bedside. And we have an opportunity to lead in this space in particular.
Absolutely.
I'm going to take a strong position on this. So every CEO of every hospital, and again, I've run big organizations, wakes up every morning and a patient was harmed, either got a wound care, died in the organization. And that happens every single day. Every single day our access goes down. Every single day our chance to win in a new healthcare economy is less. So there's like an existential challenge of adoption. But when you're running a big organization, you're more worried about reputational risk of something going wrong with an AI company. So I think we actually have to completely tilt the table here, because it's actually, we're causing harm. Like as an internist, so I'm an internist, we have like a 15 to 20% diagnostic error rate when we admit you into a hospital. So there's a complete paradigm shift that needs to happen around, so I think we're going way too slow. It can be done safe and fast. I'm not saying like be reckless and lead with your chin and harm yourself, but there's a completely, the paradigm of where the risk is completely wrong. We are okay harming people. We are okay not taking a chance on adoption of technology. We are okay creating multiple different algorithms in our research environment. We are okay not spinning out companies that create significant value for Canada. We are okay doing another pilot, whereas if something works in Nova Scotia, just do it here, right? And now what you're starting to see is a world that's becoming a little bit more harsh, and we actually have to move into the results quadrant of the box, where we're actually adopting faster, scaling faster, not putting companies through multiple different iterations. And that's the work that we've taken on, is ensuring that it's actually creating economic value and scalable change and creating bigger and bigger companies.
This requires like a standing ovation for what he just said.
Agreed. That's a very important. Thank you.
I tried to be polite.
Why couldn't we just end with that, right? Okay, so I agree with everything that was said on this panel, and I think the addition that I would say is that we're really good up front. We're really good with the research. We're really good with spinning out companies. I think where we could collaborate a little bit more is on product vision, as well as incenting adoption of the tools that we create, right? Being able to reduce the friction to market by having these highways like Can Health that we can quickly procure and implement. So I would say let's open the Canadian marketplace by coordinating with ourselves a little bit better upstream and downstream.
Dante, I just want to go back to your point for 1 minute. I'm wondering what you think, like the top couple things that we can do to actually change the paradigm shift and actually start to see things moving faster.
I think it's a certain type of pressure of, when we have ambulatory platforms, why are we not using AI there? When you actually have to start measuring adoption in a different way, and you actually have to change the, when you run big organizations, what you're ultimately trying to do is change the conditions of comfort. So low performers don't want to work there, and you're attracting high performers. So the system needs to actually change the conditions of what percentage of our Ontario hospitals are purchasing Canadian technology. If they're going to get new money, they're getting it around that. If they're going to do a pilot, if a new thing's happening and there's an existing solution, there should be like a shame on you that you shouldn't do that. When we have something like technology that we know wins, we should do less but scale that. So there's multiple different interventions. Everybody's good intention and smart. Like there's no stupid or evil people, but you have to change the incentives, and you have to deal with this reputational risk issue. Like, are you running organizations to drive short-term confidence, or are you running organizations to create long-term confidence? And you're willing to actually get a little bit in trouble by, as you are every day in your organization, just shifting that paradigm. And buy Canadian solutions. They're winners.
Thank you. Thank you so much to all of you for coming today. And I think that's about all we have for time. I know this has probably generated a lot of questions, but I think our panelists are going to be around during the lunch for networking. So please, if you have questions, come and speak to them or us at that point. Thank you.